Hi, my name is Melissa Daniels and I have strabismus. And this channel is all about my journey from having my eyes be very unaligned and not at all working together to where they are now, where I can use my eyes together and they are aligned, at least cosmetically. It's not perfect, but we're getting there. So I had strabismus surgery 3 years ago. And in that surgery, the surgeon was able to take my eyes from 35 diopters of exotropia, all the way to 25 diopters of esotropia, which was not what we wanted. And then he adjusted the sutures and I got to about 15 diopters of esotropia. And over the first year, that alignment it got even better. So instead of about 15 diopters of esotropia, it went to about 12 in the distance. And through the combination of vision therapy after the surgery, I was able to get that alignment even better so that I've got almost perfect alignment. And then in the distance, I'm down to about 8 diopters of esotropia, which is pretty good. And I'm learning how to control that so that it's getting even better. Before I jump into the specifics of how this recovery has been and where I'm at 3 years later, I just wanted to throw out there that you can get a lot of different free resources over at learn.strabismussolutions.com. You can have access to my course, you can sign up for Zoom calls with me, and there's so much more over there. So be sure to check that out. Now, 3 years later, I just want to talk a little bit about how things are going with like the redness, itchiness, swelling, my eye size, my ability to use my eyes together, and the straightness. So first of all, you can see that my eyes are pretty straight. Now, they are not perfect, and I do have a little bit of hypertropia, which means that this eye likes to go up. And this happens especially in the distance. When I'm at near, I get that perfect alignment, but in the distance. And that has been steady since the time I was about 3 years old. So I've never had surgery that addressed the vertical misalignment in my eyes, and it has never really gone anywhere. And I'm able to kind of compensate with that through the vision therapy that I've done. I've learned different exercises and tricks for keeping that alignment when I need images to be single, and just kind of working with what I have. So that has been steady and that has not changed at all. It's been 3 to 4 diopters basically my whole life. As far as horizontal alignment goes, it just seems to keep getting better, and I attribute this fully to vision therapy, because without the vision therapy, my brain wouldn't be using those eyes together. And because my brain wants to use those eyes together, it's very motivated to keep them straight, right? I've taught my brain that I want to use both eyes for my peripheral, both eyes for not perfect central vision, because anyways, that's a whole nother video, but my brain is using those eyes together. And so it's much more ideal if they're straight. And so my brain keeps them more straight. As far as the horizontal eye turn goes, it's not noticeable to the normal person. Where I used to get people looking over their shoulders, wondering where I was looking, I don't ever get that anymore. Maybe if I'm talking to an optometrist or an ophthalmologist who is able to notice those differences, they're going to notice that one eye is going a little bit up and one eye is going a little bit in, but most people don't notice that at all. And I can tell you that, man, that is such a relief. It is so fantastic to have that little part of my life, or big part of my life, that I don't have to worry about anymore. And that's just the cosmetic part. I'm also able to get much better fusion and use those eyes together, so my depth perception has just improved drastically. I can drive at night. I can do so many things I couldn't do before because those eyes are working together. And that part comes more from the vision therapy. The surgery kind of got the eyes in the right position. The vision therapy helped my brain to actually use those eyes together. As far as light sensitivity and just sensitivity to maybe like chlorinated water or sweat dripping in my eye or specific makeups or lotions, they're still the same. I feel like it's been like this for a lot of my life, but especially after surgery, I would say that there has been more sensitivity to those different things in my eyes, that they turn red more or they get itchy quicker. And I do believe that that's from the surgery. For me, totally worth it, but it just is nice to know that that is a side effect. The light sensitivity actually has drastically gone down, and I have worked in vision therapy on that and helping my eyes take in the light and helping with this amblyopic eye. So that definitely made a difference, but that has gone down over the last year. I feel like even though it's a bright sunny day, I don't have to wear sunglasses anymore, where I used to feel like I needed sunglasses all the time. So that has been something that's come over the last little while. Another question that people always are wondering about for like long-term strabismus surgery is the scarring on the eyes. And I'll be honest, I just don't really care that much about it. But yeah, there is some. Like if you really want to look up close, yeah, there's some like scarring, and I just don't think it's that noticeable or a big deal. But it is to some people, and so maybe that's a deterrent. You'd rather have your eye turned a different direction and not have the scarring. But for me, I'd rather have my eyes straight with a little scarring. It's totally worth it for me. Another one that people are concerned about is if your eyes become different sizes. That totally seems to happen. And the surgeons say it doesn't happen, but you look at people with strabismus and it seems like they usually have one eye that's more open and one eye that's more closed. For me, this eye is always a little bit more closed, especially in pictures on a bright day. That has not changed pretty much my entire life. So it might have come from earlier surgeries. It might just be because of the amblyopia. I don't really know, but this last surgery didn't seem to affect it, and it hasn't really changed over time, over the last few years as I've overcome it. Since having my surgery 3 years ago, so much has happened in my life. And I believe that the success that I've had, that the surgery has lasted and my eyes have stayed in the right position and even gotten better, is completely due to the fact that I did vision therapy. And the vision therapy trained my brain to use those eyes together. It was such an important aspect of my surgery, because without that, the brain is, even if the eyes are straight, the brain's like, well, I don't know what to do with two eyes aligned. That gives me double vision. I'm just going to like move the eye out or move the eye in. And so the brain doesn't know what to do with the eyes when they're straight. And so that's where the vision therapy comes in, is, okay, the eyes are now straight and we are going to learn how to coordinate them together. And once they're coordinated, that position can be maintained. And so I believe that when you are able to add that aspect to your post-surgery recovery, it's going to make all the difference. Now, if you don't have any idea how to find a vision therapy office, I can definitely help you with that. If you go to learn.strabismussolutions.com, you can fill out a form and I will get that. I will give you some personal recommendations. You can also schedule a call with me and we can talk a lot more about like your specifics and what your goals are and kind of help get you going in the right direction. So there are so many options. Just keep your eyes open, keep looking for them, and realize that there is a lot of hope for healing when it comes to strabismus. See you in the next video.